Welcome back, everyone. Today, we're diving into the fascinating world of bioelectronic medicine, a cutting-edge field where electrical stimulation is revolutionizing the way we treat and regulate biological processes. From chronic conditions to neurological disorders, this emerging science is offering new hope and possibilities for patients around the world. So let's get started. Bioelectronic medicine, also known as electroceuticals, is an innovative approach that uses electrical signals to communicate with the body's nervous system. By targeting specific neural pathways, scientists and researchers are finding new ways to treat various diseases and conditions that were once considered untreatable. Throughout history, humans have explored the potential of electricity in healing. With the advancements in science and technology, we can now create intricate devices that regulate biological processes with electrical signals. Let's get back to the beginning. Dating back to the ancient Egypt, Greece, and Rome in treating various ailments, ancient electrotherapy is the earliest concept of using electricity for healing. These early practices laid the foundation for the understanding that electrical stimulation could influence biological processes and relieve pain and other symptoms. Bioelectricity, discovered in the 18th century, revealed the crucial role electricity plays in the body's muscular movements and ignited scientific interest in the connection between electricity and living organisms, such as the faradic and galvanic machines. The 20th century witnessed amazing feats in engineering and medical technology that gave birth to implantable devices capable of interfacing with the nervous system. The advent of cardiac pacemakers in the 1950s was a remarkable milestone in bioelectronic medicine, demonstrating how electrical devices regulate biological processes and restore normal physiological function. In the early 21st century, bioelectronic medicine emerged as a distinct field dedicated to electrical interventions for medical purposes. As researchers delved deeper into the workings of the nervous system and neural interfaces, they discovered the potential of electrical stimulation beyond traditional neuromodulation applications. Since then, groundbreaking research is being conducted to explore the potential of bioelectronic medicine. From chronic pain to autoimmune disorders, let's take a closer look at some of the conditions that can be addressed using these technology. Central to the field of bioelectronic medicine are neural interfaces and implants, tiny devices designed to communicate with the nervous system. These devices can be placed directly on nerves, within the brain, or near target tissues. Neural interfaces are capable of both recording neural activity and delivering electrical signals for therapeutic purposes. One of the primary techniques used in bioelectronic medicine is neuromodulation, which involves the targeted delivery of electrical signals to specific nerves or brain regions. This approach allows for the precise regulation of neural activity, making it possible to address a diverse range of conditions. Advanced bioelectronic medicine systems often incorporate closed-loop technology. These systems use feedback mechanisms to continuously monitor the body's response to stimulation and adjust the electrical signals accordingly. By adapting in real time to physiological changes, closed-loop systems offer more personalized and effective treatments. Bioelectronic medicine has the potential to revolutionize pain management. We can now precisely target the affected nerves and modulate their activity to alleviate pain without the risk of addiction associated with traditional medications. Injuries or medical conditions can lead to the loss of sensory functions, such as hearing or sight. But bioelectronic medicine is opening up new possibilities for restoration. By using neural implants and electrical stimulation, scientists are exploring ways to reconnect neural pathways and restore lost sensory functions. Also, neurological disorders can be challenging to treat, often requiring complex drug regimens. But with bioelectronic medicine, a new frontier is opening up where researchers explore the use of deep brain stimulation to target specific brain regions and regulate neural activity of patients that suffers from conditions like epilepsy, Parkinson's disease, and even depression. Bioelectronic medicine is a rapidly evolving field that holds immense promise for revolutionizing healthcare. As our understanding of the nervous system and technology continue to advance, the future of bioelectronic medicine is filled with exciting possibilities. With the progress of neural interfaces, patients can now experience personalized bioelectronic medicine that enhances their treatments and reduces side effects. For example, neural interfaces allow doctors to use precise neurostimulation to treat chronic pain without the harmful side effects of painkillers. Exciting advancements in wearable and non-invasive bioelectronic devices are revolutionizing patient care, making it more convenient and comfortable. With expanded accessibility and improved treatment compliance, these devices are improving lives. researchers are constantly pushing the boundaries of technology, striving to create bioelectronic devices that are smaller and more powerful. These devices hope to achieve targeted stimulation with minimal invasion, enabling precise communication with the nervous system, improving therapeutic outcomes. Cutting-edge bioelectronic systems utilize the state-of-the-art artificial intelligence algorithms to constantly observe vital signs and modify stimulation immediately, giving patients a tailored treatment that fits their individual requirements. In the future, bioelectronic medicine is likely to be integrated with other therapeutic modalities, such as pharmacology and gene therapy. Combining different treatment encourage synergistic effects, enhancing treatment outcomes and addressing complex medical conditions. As bioelectronic medicine advances, there will be a need for robust regulatory frameworks and ethical guidelines. Ensuring patient safety, data privacy, and responsible use of technology will be crucial as this field progresses. Imagine a world where bioelectronic medicine is a routine treatment option, where patients can manage chronic conditions with wearable neural stimulators, improving their daily lives significantly. Thank you for joining us on this fascinating journey. If you found this video informative, don't forget to like and subscribe to our channel for more exciting content. Until next time, stay curious and keep exploring.